Good evening to you and welcome to our special 12 town hall on the opioid crisis. I'm Kim Kalunian. For much of 2020, our focus has been on the coronavirus, and for good reason. Close to 1,300 Rhode Islanders have died after contracting the virus. But another epidemic is claiming the lives of our friends and loved ones too, the opioid crisis. This past July, the state saw more opioid-related overdose deaths than any other month since the state began tracking those fatalities. So tonight, we're going to have a frank, candid conversation about why this is happening, the services available to those who are struggling with substance use disorder, and what you can do to help. Plus, we will be taking your questions that are submitted on Facebook. Joining me tonight, Rhode Island Department of Health Medical Director, Dr. Jim McDonald. Dr. McDonald, thank you for being with us.
Kim, thank you for having me tonight.
We're also joined by Dennis Baylor, the Director of the Overdose Prevention Program at Project Weber Renew. Dennis, thank you.
My pleasure, Kim. Thank you for having us.
I appreciate the time both of you are taking to have this very important conversation with us tonight. And Dennis, you have an extremely powerful story to tell, and I believe your perspective is going to shine a unique light on this crisis for our viewers. But before I ask you to share your personal experiences, Dr. McDonald, I'm hoping you can walk us through exactly what we're seeing with the opioid crisis, particularly here in Rhode Island right now.
Yeah, thank you, Kim. You know, I think it's important for us to start with the pandemic isn't really occurring in isolation. In other words, it's not like we're just having a pandemic. We have this overdose epidemic that's going on for years. And when you have two things going on at the same time, like big epidemics going at the same time, that's called a syndemic. And although a syndemic might be a new word, folks, it really describes what's happening in Rhode Island right now. You know, one of the things I think it's important to understand, why are we stuck with a higher death rate from overdoses in Rhode Island right now? We're talking about a 25% increase in deaths since the same time year over year compared to last year for all drugs, and over a 33% increase when you look at just opioid overdoses. So we really see fentanyl has been driving a lot of this. The potent product of fentanyl, which fentanyl is very potent, is driving a lot of the overdose epidemic in Rhode Island. You know, what we see is the shift has occurred in where we see illicit opioids coming in. What used to come in from China now comes in through Mexico. So we have different suppliers, and they're shipping a different product. What I learned from my law enforcement colleagues is about 15% of the counterfeit oxycodones that come into Rhode Island have more than 2 milligrams of fentanyl in that. So that's a lethal dose. More than 2 milligrams is a lethal dose. So what's important about that is it sets people up to have that first dose be their last dose. And this is part of what's driving it. What we're also seeing is more polysubstance use. In other words, more cocaine use, more methamphetamine use, other stimulants being involved, and quite frankly, even some things we haven't seen before in our island, like xylazine, which quite frankly, xylazine should be new to everybody. It's a veterinary anesthetic, but that's entered Rhode Island this year as well. So we're seeing new drugs occurring. We're seeing it occur in this syndemic, and it occurs in a background of just things that have always been problems. If there's one thing I've noticed about the SARS-CoV-2 virus, it's a magnifying glass for all of our problems in our culture. So social determinants of health are a problem, and it's just driving this issue so much so that it's really become problematic in Rhode Island. So we're seeing substantial increases here, and that sets the stage for why I think it's important for us to get together tonight and just honestly talk about what's going on in Rhode Island, and do we have solutions? Do we have ideas? Do we have hope for tomorrow?
Yeah, and Dr. M, we will certainly be talking about the steps that people can take. I wanted to ask you about you said 25% increase in deaths and 33% increase in deaths related to opioids. Can you just put in perspective, I feel like we might be on track this year to break some records that we don't necessarily want to break.
Yeah, I think that's true, Kim. You know, in 2016, we had the worst year in Rhode Island history. We had 336 deaths. As of today, we have 294. And keep in mind, there's a 3-month delay in reporting the deaths. So right now, I think we're going to be over 400 deaths for 2020. And that's a hard thing for me to say. But quite frankly, it just speaks to how bad the epidemic has been in Rhode Island this year. And it really started at the end of 19. You know, December of 2019, I didn't really learn about how bad that was until March of 20. But that was the worst December we've ever had, and it occurred right as I was really getting into the pandemic. But it really signaled that the potency of the product had changed, and that's where we see that. So we're really on pace for the worst year in recorded history in Rhode Island, which is not an easy thing for me to say.
And I know you've been using the term syndemic, which is new to me since we've started discussing the opioid epidemic paired with the coronavirus pandemic. And I'm wondering, one question that we've been seeing a lot from our viewers who were getting ready to watch this with us tonight, how is the isolation, the anxiety, the depression that comes with the coronavirus pandemic impacting people's use of these substances?
Yeah, the right answer to that is, yeah, all of the above and a whole lot more, right? Because I think what you're seeing here is isolation doesn't help anybody, period. But the pandemic has caused a lot of isolation for everybody, and I mean everybody in that regard. And for someone who's living with opiate use disorder or substance use disorder, they're isolated as well. So that urge to use is still there. But if they use alone and there's no one there to rescue them, then they're more likely to die from that. Keep in mind, if you're not under a lot of stress right now because of the pandemic, then you're not being honest with yourself. Because quite frankly, all of us are under stress during the pandemic. But it is making issues like anxiety worse, making issues like depression worse. And sometimes people have both issues. Those are called co-occurring disorders. In other words, when someone's living with substance use disorder, but also living with mental illness, that's called co-occurring disorders. And they just get worse during a time like this. And keep in mind, interesting enough, we couldn't get toilet paper during the pandemic. I'm even seeing now this is a problem as we're in the second wave, but the illicit drug supply isn't interrupted. In other words, that market still continues, which I think speaks to it's a non-traditional market. It doesn't affect it as much by the pandemic. So it really sets me up. But the risk factors are higher now during the pandemic. So the pandemic makes it worse. It kind of gets back to my point about this pandemic is a magnifying glass. Everything it touches, it makes a lot bigger and a lot worse.
That is certainly true. And Dennis, I want to pivot to you now. I know you previously struggled with substance use disorder, and I'm hoping that you can paint a picture for us, because we know that this use disorder knows no bounds. It does not discriminate based on age, class, race. So I'm hoping that you can take us back to the beginning of your journey and shine some light on your struggles and hopefully reach some people out there who might be going through what you went through.
Yeah. Well, Kim, when I think of my past using substances, it's a dark place to be at. I too did suffer from the co-occurring disorder, the mental health as well as the substance use disorders, but it's just a dark place to be. People out there, the spirit is broken, their heart is broken, our dreams are crushed, and just those we're torn apart from our family.
Might be going through what you went through.
Excuse me?
Sorry, Dennis, I think we might have just had a little bit of an echo there. I'm hoping that you can continue with your story and just tell folks, how did you end up turning to drugs, and what was the turning point for you in terms of recovery? Yeah.
Why I turned to drugs, I think, had to do with my discomfort as a teenager. There's a term, being uncomfortable in your own skin. I was so uncomfortable in my own skin that I had to find a way to escape. Back then, when I started using, the easiest way to escape was through drugs and alcohol. With the use of drugs and alcohol, speaking for myself, it calmed me. I have slight social disorder, so it calmed me. It took the edge off. Why my usage changed to a disorder where I couldn't stop, that I can't really explain. I just can't. I know it's a brain disease. It wasn't something that was by choice. So something in the back of my brain put me in a position where I was unable to stop. No matter how hard I wanted to, how many times I tried, despite the consequences of my actions, I just couldn't make the good choices to stop. However, through of course some internal strength, and also the help of community, the help of people who had gone through the same difficulties that I had gone through, the 12-step programs, I've gone through most of the treatments and rehabs in the state of Rhode Island, so I continue to try. But it's that sense of community, that sense of that connection that we get speaking with others who've gone through the same struggles that helps to pull us out of that hole. And when I think of these days with COVID, a lot of the things that people require to recover from substance use disorder is suggested to them not to do. That is being with others, seeking help, that feeling of community. There's a lack of that because of the pandemic. A lot of people who are trying to recover cannot connect. It's recommended that as Dr. McDonald already spoke to kind of isolate yourself. Well, people with substance use disorder and isolation, that's a bad combination.
So how are you overcoming that? I know this is your bread and butter now, working with folks to try and get them back on the right path to recovery. How do you overcome the challenges and the barriers that COVID is currently putting in place?
In regards to my work, you mean?
Yes.
Yeah. Well, I'm fortunate to be in an organization to work with a lot of passionate and brave people. Our organization, we do outreach, and we also have a drop-in center in Providence. And, we practice, we utilize safe practices that are recommended to us by people like Dr. McDonald and other individuals. We try to utilize safe practices, but we consider ourselves frontline workers because we are really out there on the streets, in our vehicles, engaging with individuals who are stuck in substance use disorder. I mean, there's nothing that I can say in regards to anything extraordinary, in my opinion, extraordinary that we're doing to try to change things. We're just trying to do what we've always been doing. When the pandemic hit, we didn't stop. We didn't stop our outreach. We know that our clients, they still need us out there. They still need to know that someone cares. So we go out there, we try to show that to them. We provide them with just a good listening ear. We provide them with various types of supplies. We're not going to give up on the individuals who are out there and who they just need support. They need harm reduction supplies and support. So we're going to continue to do it. We wear masks, we wash our hands, we're always sanitizing our van. We have 2 vans that go out pretty much up until, I was up last night from 6 p.m. until 10 p.m. Just riding around in our van, seeing some of our normal clients, some new clients. We give them hand sanitizers and masks along with other harm reduction supplies. But, we can't give up on these people. We value these lives. We don't want to see any more lost. Overdose and overdose deaths are preventable, but it takes people who are going to really make the effort to go out there and do it. And I'd like to think that our organization and many other organizations, we just continue to do the work. We're just not going to stop.
We hear a lot about Narcan and the distribution of Narcan, and folks have been encouraged to carry it with them if they can. Dr. M, I'm wondering, it seems like this has become something that is more widespread, more widely available, and yet we are still seeing these tragic deaths. Can you talk a bit about why we're still seeing so many deaths when Narcan is now something that's people know a little bit more about, and also remind folks if they do want to get some of that Narcan, how they can do so?
Yeah, so Kim, I think Narcan's a great thing, but the Narcan of itself won't solve the overdose epidemic. The epidemic's much more complicated than that. So Narcan's a good thing to have, and you can get it at any pharmacy, CVS, Walgreens, any pharmacy has it. And there are actually places that deliver Narcan as well. In other words, Dennis's organization, Project Rubber Renew, AIDS Care Ocean State, Parent Support Network. These are places that will actually deliver Narcan to you at no charge, and they'll deliver to everywhere you're at. It doesn't have to be your home; you can deliver to you anywhere. And if you're looking for how to get Narcan, one of the easiest places to go is our website, preventoverdoseri.org. In the left-hand corner is a big red button that says COVID-19. Click on there, and it gives you all the resources you need to get Narcan. But I really think it speaks to these larger issues that Narcan is one part of the problem. But if someone's using in isolation, then who's there to give that person Narcan? And the answer is no one. So this gets to one of those other concepts that we need people to have other people around them who can at least watch them. And, you know, one of the things we've also seen is that the drug supply isn't pure. It's contaminated. There are people who thought they were using cocaine, and for the life of them really thought all they had in front of them was cocaine. And it looks like a white powder, but sometimes it's not cocaine. Sometimes it's got, you know, it's really fentanyl. And that's why some people find using fentanyl test strips to be helpful. In other words, a fentanyl test strip is something that Dennis's organization will give you, or AIDS Care Ocean State, or RICARES, and they'll give it to you free of charge, and you can test your product to make sure you've got what you think you have. Now, that may sound like an uncomfortable thing to people, like, is the state enabling people using these products? Well, the bottom line is these are harm reduction strategies. In other words, what we're really trying to do is help people live to another day when they're ready for recovery. And recovery means a lot of things to a lot of people, but we'd like to move people into recovery, but not everybody's ready at this moment for recovery. And so it just really gets people to where we are. But Narcan of itself, as important as it is, isn't the only answer. And one of the things that we can do too with Narcan, though, is that if you're living with someone who has substance use disorder, whether it's cocaine or whether it's opioids, you know, it'd be good to have Narcan in your home. And that's where just going to a pharmacy, it's covered by your insurance. Might have to pay a copay, but it's usually pretty modest. It would be a reasonable resource. It's a way to help get the Narcan in your home.
And Dr. M, you and I were talking a little bit about this earlier this week. The idea of supervised injection sites, do you think that those are a good idea? I know it's a little bit of a controversial proposal.
Yeah, I think it's controversial until you study it. And once you study it, I think it's compelling. You know, I've talked to colleagues in Montreal and those in Vancouver and other places in Europe. And we tend to refer to them as overdose prevention centers. Because when you have a place where people can use in a supervised manner, the number of deaths are really compelling. It's almost zero. So in other words, you know, it's a place where we can do some of the other things we'd like to do to help people. Like we can offer screening for HIV, hepatitis C. If someone's interested in treatment, we can just say, here's the number, we can help you. You know, where are people? We can meet people wherever they're at. And the point I'm trying to make, though, is that it's controversial till you've studied it. Once you've studied it, you realize that we're basically have these places in Rhode Island, but without any of the public health benefit already. In other words, there are places where people are using, but there's no one there to monitor them. And there are places where people are doing that, but there's no one doing any health screening. There's no one helping people get the resources they need. No one connecting them to Project Weber Renew. And the point I'm making is right now we have all of the risk and none of the benefit. So some laws we need to change in this state, but I think they could change in a reasonable and meaningful manner. We can still have the safeguards we need as our culture and our society, but I think we need to move more towards decriminalizing what we know is a medical problem and really addressing it in a way that makes the most sense. So I think the argument for overdose prevention centers is how we tend to call them. I think it's compelling, and I think it's something that just we have to take a long, hard look in Rhode Island about how do we want to amend our laws so we can balance this and make it possible. I think that's the really main thing we can do to stop the deaths. I mean, we've done a lot of good work already over the last several years, but it's time to admit when what you're doing isn't working, if you keep doing the same thing and expect the same outcome, that just isn't what usually happens. And what it's time to do now is think a little bit differently about what have we learned from other countries. And this is where I think an overdose prevention center is really necessary.
Dennis, I know Project Weber Renew takes a very proactive approach to helping people. And if there are people out there watching this right now who are either struggling with substance use disorder themselves or know someone who is struggling, what is their best course of action and how can they get in touch with your organization?
When those getting in touch with our organization, they can, first of all, they can come by our drop-in center here at 640 Broad Street in Providence, or they can go to our website, which is simply weberrenew.org, or info@weberrenew.org. I just want to back up for a moment and speak on that overdose prevention center subject, if I may. See, the fact of the matter is, when organizations like ours and other organizations do an outreach, people are going to use anyways. If they suffer from substance use disorder, they're going to use. So where are they going to use that? They're going to use it behind a building, under a bridge, in a park, in the mall. They're using, and lives are at risk. All we're saying is, why not have a safe place? Now remember, it's an overdose prevention center. So it's not only about a place to come to use. We're talking about treatment, recovery, talking about wounds. We're talking about just showing people, reminding them that their lives can change and recovery is possible. Even for the worst of us, recovery is possible. But unless we're going to go out there and remind people of that, that steps away from the thought. So the Overdose Prevention Center and with COVID, I believe that we're doing our best to manage it, but it's about the data, right? It's about following the data, looking at the information, following the data. As Dr. McDonald mentioned, look at the data in regards to overdose prevention centers in other countries. Deaths are at zero. It saves money for police response, ambulance response, fire response, hospitalizations. It saves millions of dollars. Why can't we put something in place that will save hundreds of lives and save millions of dollars? It's like a no-brainer. We take a close look at it. It's a no-brainer. It's just, as Dr. McDonald said, it comes down to changing some laws and looking at the legislator and trying to get people on board. But again, it's a win-win. It's simply a win-win. People with substance disorder, as I know firsthand, are going to use anyways. They're going to use. Put something in place to try to save some lives. These deaths are 100% preventable. We just need to have the right tools in place in order to achieve that. In regards to if there's someone in your family who's suffering from substance use disorder, first thing you have to know is it's not a reasonable choice. It's not a choice that we're making. I didn't choose to separate myself from my family. I didn't choose to be. It wasn't a choice with my disorder, with my brain disorder that took me there. So we want to be patient, we want to be understanding, we also have to protect ourselves. We want to be able to protect ourselves. We want to refer them to the many organizations that are trying to do this work, organizations like Parent Support Network, Anchor, Amos House. There are many organizations, Good and Care Alliance. Depending on what area you're in the state, refer them to your local organization. You'll be able to find a peer. I'm a peer recovery specialist and also a community health worker. You'll be able to find a peer that hopefully your family member can connect with and build some type of rapport with. And through that connection, we can oftentimes make suggestions and encourage people to make those changes. And again, the changes are possible. They're necessary and they're possible. Again, we just need to have the right tools in place. We've got to have the peers around and available to assist those people. And again, it's not an easy road to be in. It's not an easy road to undertake, but with love and patience and compassion, empathy, we can turn people's lives around, and it's happening every day. It happens every day.
Dennis, love and patience and compassion, things that all of us can use and certainly show to others. Dr. M, I wanted to ask you a question. I'm paraphrasing here from one of our Facebook viewers named Lori. She said it appears that doctors seem afraid now to prescribe opioids, and this is a question that we've seen a little bit too on Twitter, this idea that maybe doctors shouldn't be prescribing, I should say, these opioid painkillers as much anymore. What are your thoughts on that?
Yeah, Lori, it's a great question, and I think it's the right question too. I think, this just shows where medicine went, by the way. Medicine 20 years ago, 25 years ago, a lot of this was fueled by Purdue Pharmaceuticals and other big pharmaceutical companies telling doctors that, take an opioid, people won't get addicted, the pain will block their problem with addiction, so they're safe. And these medicines aren't addictive. Well, we've learned that that wasn't true. It never made sense to me, by the way. I was around when those messages were given, but, this is what people heard. And quite frankly, there was a whole generation of physicians who prescribed this into this epidemic. But the prescribing has changed a lot. I think we've seen it really improve dramatically in Rhode Island since 2013 and 14. It's really moved in the right direction. And so what Rhode Island has done is try to move towards what's called responsible prescribing. In other words, recognizing when someone needs medicine for pain, then we want to make sure that for end-of-life issues, people who have cancer, someone who's post-surgery, that they have what they need to block the pain receptors. But that's really where it's important, Lori. A prescription opioid blocks the pain receptor. It doesn't treat the underlying cause of someone's pain. And most of the time, what you really want to do is actually treat the underlying cause of someone's pain. And a lot of times, there's more safe medicines out there that are just simply, quite frankly, better at doing that. And so that's where it's just important to say, well, what's the best medicine for my patient? So we actually have a pharmacist who goes into doctor's offices, does one-on-one education. We've done a lot of continuing medical education to show, look, there's a lot of better choices out there than these older prescription opioids that really did sweep us into this epidemic we're in. Now, as I said earlier, it's the fentanyl from outside the United States that's driving our problem now. But if we look at what brought the current generation in, it was the prescription Percocet, the prescription Vicodin, the OxyContin, and the other forms of oxycodone that really brought us into this. So that's where it's just important to say, look, it's got to be about responsible prescribing. No one's saying we should suffer needlessly, but I think one of the things you look at most physicians these days, I don't know that they're simply afraid to prescribe. I think they're just saying, I've had to learn differently. And one of the things I think we need to think about is, in Europe, one of the more common messages in Europe, it's interesting, we published a study in the Rhode Island Medical Journal last year that looked at the difference in prescribing in the United States versus the prescribing in Western Europe. Vastly different in Western Europe. In other words, it's very rare in Western Europe for anyone to get a prescription opioid for an outpatient medical anything. So for any outpatient medical diagnosis, it's very rare for someone in Europe to get a prescription opioid because this is not how it's done. Because in the culture, what's taught in Western Europe is pain after surgery is part of healing. If you're hurting, you probably shouldn't be moving around as much. And if people have problems with pain, it's anti-inflammatory medicines that people move towards because those are safer and more effective. And it's just important because in Western Europe, much less overdose deaths than we have in the United States. Part of the reason for that is we just don't have as much irresponsible prescribing of opioids. The prescribing of Rhode Island has gotten a lot better in the last 6-7 years. So to that extent, I think we're heading in the right direction there.
That is fascinating, Dr. M. Thank you for that information. I want to ask also about, there was a recent move by Oregon to decriminalize certain drugs, small amounts of cocaine, heroin, methamphetamine. Do you think this is something, Dr. M, and then Dennis, I'd like for you to weigh in on this as well. Do you think this is something that would be helpful?
Yeah, it's a different way of thinking, isn't it? Doesn't it strike you as like, I thought these things were illegal? Well, they are, but guess what? You can't incarcerate everybody. And I really think it's right down to is we do over-incarcerate people in our state and in our country. And the reality is people who have these small amounts of these products on them, whether it's cocaine or heroin, these individual people who have these small amounts really need to be brought into treatment. They really don't need to be put into prison. That just isn't going to help them as much. And bringing people into a treatment mindset is really more likely. And you've seen Portugal do this, a country that's had a great deal of success with this. And I think part of what we need to do as Rhode Islanders and as Americans is say, look, how do we learn from other parts of the world of how people are dealing with these common problems with humans? And the reality I see in front of me is that incarcerating people, the dealer, that's a different animal. We got to be very conscious. We can't condone people dealing, but the user, we probably need to help that person get into treatment. That's a much better place for that person. I'd be curious what you think about that, Dennis.
Well, there's no doubt about it. We cannot arrest ourselves out of this overdose epidemic. If anything, we're putting some people at a higher risk. When a person's has substance disorder and an opioid use disorder, and we lock them up for a short period of time, as short as 5 days, their tolerance drops. So if they come out after a short stint, okay, that's all they're going to get is a short stint most of the time for some possession charges. When they come out a block out after that. Their tolerances drop. They're going to, a lot of times they use at the same pace that they were using when they went in. And guess what happens? They come out, they use, they wind up overdosing and dying. You know, and as Dr. McDonald said, the individuals with those small quantities, criminalizing them is not the answer. Criminalizing them, giving them fines and court fees, that's not going to make them stop. It's the therapy, the help that they need in order to stop. It's a subject where, again, as a person who's experienced it, and as a black man who's experienced it, I can tell you that just turning us into criminals, sending us into prison, binding us with felonies, that doesn't work. It simply doesn't. If it had worked, we would know that by now, wouldn't we? But we know for a fact that locking people up for small quantities of possession is not the answer. I think it's a good idea to change those laws. The criminalization of substance use disorder is just not. It's not showing any work. We know that we need to make some changes in that regard.
As people watch this tonight, I wonder if anyone out there is feeling sort of like I am. What can I do to help curb this problem? Dr. M, what can a Rhode Islander who's at home watching this right now do to help save some lives?
Yeah, so here's some ideas that are concrete. If you know someone who's living with opioid use disorder or substance use disorder, we actually have set up a 24-hour-a-day, 7-day-a-week line for people to call and, quite frankly, have a conversation with the doctor. And if medication-assisted treatment is right for that person, you can call the number. You can call the number right now. It's a local number. It's 401-606-5456. So if you call 401-606-5456, you'll talk to a Rhode Island doctor. Could be my friend Dr. Samuels. Could be any one of the doctors who's doing this. But they'll walk through a regular doctor visit with you. And if medication-assisted treatment like buprenorphine is right for you, they'll send in a prescription to the pharmacy. You don't have to go anywhere. The visit doesn't cost anything. So you can, have a telephone conversation or, whatever makes sense with the doctor and get that prescription tonight. And you could do that. You could start. And so you don't have to feel miserable anymore. And you can get out of withdrawal and we can take care of you. And then we can get you into treatment. So that's a good place to start. Not everybody's ready for that right now. So, if you're living with someone who has opioid use disorder or substance use disorder, think about just making sure you have Narcan on your person. I think one thing all of us can do, though, is think about our language we use. Dennis made some powerful points tonight. Dennis is in recovery, and he's a powerful example of the power of recovery. But Dennis said multiple times it wasn't a choice. And I think we need to be careful about how we judge people. When people are on Facebook posting, it's a choice, just let them die. Those are hurtful comments, and those traumatize people. And it's just not helpful. So the language we use matters. And I think we have to think about what are the words we use. And some of the words that we use that, quite frankly, like junkie or addict, those can be very hurtful terms, and it's not really accurate. We certainly don't victimize other people with chronic diseases like cancer or with diabetes, or it just isn't helpful to do that kind of thing. So those are some things. I think another thing we can all do, though, is if we do have an injury and we had to go to the doctor, had some kind of problem, is make sure we don't get a prescription opioid, because that's how people get started. Interestingly enough, 10% of Rhode Islanders in the last year were started on a prescription opioid, maybe for legitimate reasons, but maybe for other reasons where, quite frankly, Tylenol or Motrin would have done the trick. If you've had an injury, inflammation is driving your problem. It's what inflammation does. It drives your injury. Well, an opioid just blocks the pain receptor, doesn't take away the underlying cause. So if you sprained your ankle, you need to rest, get some ice, take some Motrin. You don't need Percocet or Vicodin and walk around to work the next day. You're not listening to your body. It's really important to listen to your body. I think those are 4 things that any one of us can do.
Dr. M, thank you. Dennis, same question. What can folks who want to help, what actions can they take?
Get involved. Get involved. Go to the Prevent Overdose RI website. find the local organizations in your area that are doing this work, either harm reduction, treatment, or recovery work. Get involved. Our organization, we're a small nonprofit. People can go to our Facebook page and our website. They can find ways to advocate for change. There are many organizations that are trying to approach this from a legislative angle. Again, just being involved, having your voices heard, learning about these various subjects like overdose prevention centers, medicated assisted therapy, harm reduction organizations, and the supplies that are given out. Get information, get involved. We value each and every life. Each and every life that we encounter has value. And for the individuals who say, just let them die, they're an addict, let them die. Well, that's an individual who doesn't have value to every human life. If you value life, you want to look at it differently. Again, you want to show empathy, but there are various ways to get involved. Just like I didn't think I'd be doing this work. I didn't set out to do this work, but I saw that there was a need, and I thought that I could add something. Little did I know I'd be in the position that I am today, but it's just you never know how much of a difference you can make until you actually step in, get involved, and see what's going on in this work. And each and every one of us has a place that we can add something to these organizations and to this work. So I would just say, do some investigation and get involved. And as Dr. McDonald said, the Surgeon General of America saw the number of deaths in 2017. It was 72,000 deaths in that particular year. And he recommended that everybody be aware of the signs of an overdose, and know how to respond to an overdose, and if possible, have Narcan on hand. And again, through various organizations, like yesterday I did a training with a group of students, a group of approximately 85 students and community organizations, a big group. We did a large Narcan training. Again, information, as we all know, information is power. So get information, get Narcan. Just don't be afraid to make an effort.
Before we wrap up our town hall tonight, I wanted to give you both the opportunity to share some final thoughts. So, Dr. M, we'll go to you. Final thoughts as we wrap up our town hall tonight.
We're in a very interesting time in Rhode Island history. As we navigate this pandemic, I just want to think of it this way. We're navigating this together. So this is really our story, and we're working on it together. And I think a lot of good is coming out of what I see in Rhode Island. A lot of us are, very much invested in taking care of each other. I think it's important as we navigate the pandemic, we have to recognize we're navigating the opioid epidemic and the overdose epidemic at the same time. There's also issues like adverse social determinants of health. Where people live, work, and go to school really gives them either advantages or disadvantages. And I think we need to be cognizant that all over Rhode Island, we have a lot of things in common. One of the things, though, is that it's in everyone's best interest for everyone to have good schools, safe neighborhoods, and living wage jobs to make a difference. And I think we have to start thinking a little differently. And as we challenge our mindset about what are some creative thoughts, I think one of the things our legislators need to think about is an overdose prevention center something we can do in Rhode Island? It's different, but it's been successful in other countries. And I'm a big fan of giving people second chances and giving people an opportunity to live another day. I know a lot of people in recovery. I know them to be honest, authentic, real, beautiful people. And they're our friends and neighbors, and they're very much worth saving. So I think if we think about it in that way, in a very positive light, it can inspire us and motivate us. Thank you.
Thank you. Dennis, any final thoughts to share?
Well, I too am proud of what our state has done so far in regards to the efforts to save lives and deal with substance use disorder. But I believe that our state needs to make that next step.
that next step is the Overdose Prevention Center. I firmly believe that. Again, these deaths are preventable if we have the right locations in place, the right people in those locations. We can prevent these deaths. I mean, again, I think that's the next step we have to take. And if you believe in that and you want to advocate for that, again, you can go to our Facebook page. You might find some information in regards to getting involved to get that available in our state. But you know, we've come a long way, but we can't stop. We can't stop where we are now, because the deaths are increasing. They're increasing right now. So for us to be stagnant and not take those next forward steps, I think it's just a wrong move. So what I would want to say in the end is that our state needs to make the next step and look into the harm reduction center or overdose prevention site to again help save more lives. Thank you, Kim.
Dennis, thank you. I want to thank you both for taking the time out of your night tonight to have this very important conversation with us. Again, Dr. Jim McDonald, Medical Director from the Rhode Island Department of Health, and Dennis Baylor from Project Weber Renew. Thank you both for your candid conversation, your insight, and for the work that you do every day. And thanks to all of you for joining us here on WPRI.com and the WPRI 12 Facebook page. You can continue the dialogue below in the comments. Leave us questions, and we will have links to all of the resources we talked about tonight on WPRI.com. Again, thanks for joining us here, and have a great night.